Welcome everyone. I am incredibly excited for today's video because today I have the pleasure of welcoming a very special guest to the channel. He is a professor of psychiatry at Harvard Medical School in Boston, Massachusetts, and chief of the Biological Psychiatry Laboratory at McLean Hospital in Belmont. He has authored more than 350 peer-reviewed papers on a wide range of topics in psychiatry, including work on psychotic disorders, major mood disorders, eating disorders, and substance abuse. Starting in the 1990s, he began to focus increasingly on substance use disorders, with particular interest on the abuse of anabolic-androgenic steroids and other performance-enhancing drugs. And he's testified about anabolic androgenic steroid use before the United States Congress and other United States federal bodies, and has also appeared in numerous documentary films on the subject, such as The Man Whose Arms Exploded and Bigger, Stronger, Faster. He is none other than Dr. Harrison Pope Jr. Dr. Pope, welcome to the channel, and thank you so much for being here.
My pleasure.
Yes, I'm super excited to have you here, and I really appreciate your time today. Come in and share with the viewers and with me some of your expert insights on this incredibly important topic in sports medicine of steroid use. So to kind of kick things off, could you talk a little bit about your background and how you found your passion in psychiatry and substance use disorders?
I originally had intended to become a psychologist rather than a psychiatrist, and would have ended up writing books about American youth and other topics of that nature. But in the late 1960s, President Nixon chose my birth date out of a goldfish bowl as number 8 out of a possible 365, which means that I would have been on the next plane to Vietnam. So I decided I'd go to medical school to buy myself a few years of delay. And as a result, I ended up becoming a psychiatrist rather than a psychologist. And now I'm glad that I got an MD degree because the field of psychiatry has become increasingly scientific and increasingly biologically based.
Very cool. That's actually a very fascinating path. It's very insightful to kind of hear your insights as well on how some of the political issues in the 1980s also took you in that direction. But do you think that it was the right direction for you,
Definitely,
for sure?
yes. I have now been here at McLean Hospital for 51 years. I came here
Wow.
straight out of medical school on July 1st, 1974.
Wow, that's a long path, but very rewarding based on a lot of the work you've done. Um, So your research has extensively examined some of the psychiatric and physical effects of anabolic androgenic steroid or AAS use. Could you describe a little bit about what these steroids are and their effects?
Okay, so nature's original anabolic steroid was testosterone. Testosterone is the natural anabolic steroid, so to speak. And it was not until the 1930s that scientists actually isolated testosterone and found its chemical structure. Shortly thereafter, in the late 30s and early 40s, hundreds of synthetic variations on the testosterone molecule were synthesized, and this became the family of what we call anabolic androgenic steroids. Initially, steroids were used as a possible treatment for aging men whose testosterone levels were falling too low. But then in the 1950s, people began to discover that you could gain huge amounts of muscle mass by taking these drugs. The
Hmm.
Russians first got busted for using steroids at the weightlifting championships in Vienna in 1954.
Yeah,
And steroids then spread like wildfire through elite athletics, especially strength sports like the shot put and discus and other such things. But it was not until about the 1980s that we see steroids beginning to percolate out of the elite athletic world and into the local gym. So this is of all of the world's major substance use disorders, steroids are arguably the youngest substance use phenomenon because they've only been widely used for the last 30 or 40 years.
very interesting. And so I heard that you talked a little bit about the 1930s and 1940s. Am I correct in saying that some of these steroids originally came up in Germany, right? Before they came to the Americas
Yes, the discoveries were made in Nazi Germany
in
in the
Nazi.
late 1930s. And one of the people who was involved actually won a Nobel Prize for the discovery of
Mm,
testosterone.
very interesting. And then did they come to Britain and the United States and then I guess across the world because of the Olympics in the 80s and the 90s? That's really where it
They
exploded.
they they reached the elite sports, the Olympics and other things, as early as the 1950s and early 60s. I
Wow.
was just
Okay.
saying that it was not until the 1980s that you see steroids being used by ordinary rank and file weightlifters in the local gym.
Oh, understood. Okay. Wow, that's quite rapid progression that they've gone through. And another question, would you say that their usage across the world is still increasing today?
Well, the number of people who try steroids for the first time in any given year has remained roughly similar over the last several decades. But of course, the total number of people who have used steroids at some time in their lives has steadily increased because of the fact that there are more and more people coming in at the bottom end, and most of the people who've used steroids are still alive at this point because
Mhm.
they did not start until after 1980.
Understood. Okay. Well, that's very interesting and kind of I guess a little scary to see how many people are still trying it today. But and how many ordinary people have come to start at least trying it in their athletic careers. Um, and due to this progression from, as you said, from the 1950s and 60s through the 70s and 80s, from Olympic athletes and professional athletes to just ordinary people using it, um, I kind of wanted to talk about the effects of steroid abuse in people and in athletes. So I know in your you published an article in 2017 in the Springer Journal, where you used a random response survey to see how many people really are using steroids or get an idea maybe compared to what tests might uncover due to the false negatives and false positives that may be common in such tests. And through that study, you saw that doping is far more common than we see in tests. Could you talk a little bit about that and also describe some of the effects that these such steroids have?
Sure. The study that you're describing used a new technique, which is known as the randomized response technique. It has been around only for a few decades. So if I'm going to come up to you and ask you a sensitive question, have you ever used steroids? Have you ever had a drunk driving conviction? Are you positive for HIV, etc.? The chances are that I'm not going to get a straight answer from a lot of the people that I interview. So you have to devise a technique where I can ask you a question and I can guarantee your anonymity. I can guarantee that there's no possible way that I or anybody else could ever find out uh, what you answered. So
Mhm.
the way it works is I come up to you and let's say that you're an elite athlete at a world athletic competition, and I come up to you with a tablet, a computer tablet, and invite you to do the survey. And I assure you right at the beginning, I say, there's no way that your confidentiality can be busted here, as you'll see when you take the test. So I give you the tablet, and first of all, you choose which one of 23 languages you would like to do it in. And the tablet then on the first screen, it says, think of somebody you know, your
Mhm.
your mother, your wife, even yourself.
Yeah.
If that individual was born in the first 6 months of the year, I want you to answer question number one when you get to the next screen. However, if that person was born in the second half of the year between July 1st and December 31st, then I want you to answer question number two when you see the next screen. Okay?
Yeah.
And then you turn to the next screen. And question number one says, the person that you were thinking of, were they born on an odd numbered day? On a 1, 3, whatever. And question number two says, have you ever used an illicit doping substance in the last 1 year? And then I remind you, there's no possible way that I can bust you, because if you answer yes, for all I know, you're just saying that, yes, the person you were thinking of was born in the first half of the year on an odd numbered day. And there's no way that I can tell that a yes does or does not mean that you have used doping substances.
Mm-hmm.
However, if I do that for 1,000 people, then I can statistically calculate how many people may have been doping. Because if there were no dopers, then out of 1,000 people, only 1 out of 4 would answer yes to both of the two, to question number one and then to question number one on the other screen. So any number of respondents over 250 represents potential dopers. And when we used that technique, instead of finding that we were found that with ordinary blood and urine testing, the number of people who got busted was anywhere between 0.5% up to maybe 3%. But the number of people who admitted to actually using doping substances under this anonymized method was anywhere from 30 to 50%, drastically
Wow.
higher than
Wow.
had been the case with ordinary body fluid testing.
Wow, that's really, really interesting to hear. So kind of removing that social desirability bias aspect from other types of testing that you might have, right?
That's right. It's a way to be able to get a straight answer to a
Mm-hmm.
question that otherwise would be too sensitive to be trustworthy.
Yeah, that's very, very cool. Actually, it reminds me of something I saw. It was a TED Ed video that I was watching, I think a couple years back, and it was about they were showing like an election in a city of in a city of beings, and there was like a tree and versus like a troll, and they were both running for the president, and the troll was somebody that no, but like it would be despicable to vote for them kind of thing. And so the only way the vote could be taken was through verbal. Like, so you would go up to the door and you would ask, who are you voting for? So they did a test where you had to flip a coin. And if you flip the coin on one side, you have to say you're voting for the troll. And if you flip the coin on the other side, then you say whatever you actually want to vote for. So that voting process is pretty similar to what you did, right?
That is another type of randomized response technique. Precisely. Yes.
Very,
There
very
are a
interesting.
number of such techniques. The one that I described is one of the most common, but there are several ways to do the same thing where you guarantee anonymity in your respondent.
Um, and you said that this was a very new technique. Would you know why that is? Like why people didn't think of doing this previously?
Well, the idea had not been conceived until it seems to me the 50s or the 60s. I can't remember the original scientific paper that proposed such techniques. But
Hmm.
once it had been proposed, it began to catch on. And now there have been quite a lot of studies of many sensitive questions, not just doping use, using techniques of this nature.
Hmm. Very cool. That's really interesting how you're able to go about that and kind of uncover a lot of things that tests may not even be able to accurately discern. Um, so could you also talk about because you saw this much larger amount of people who were doping in in this study compared to what we see from the test. Could you talk a little bit about the effects of doping and what athletes might suffer if they use steroids or anabolic androgenic steroids?
Sure. First of all, let me dispel one myth. Many people, especially people without any formal training, think of steroids as a problem of cheating by athletes. But in fact, a substantial majority of people who take steroids have never taken the steroids for the purpose of any athletic competition at all. They just take them because they wanted to get big. And those people, the other 80% of steroid users, are the big public health problem. The athletes are only a small fraction of the issue. And it is mostly the ordinary rank and file guys in the gym who are potentially at risk for some of the long-term effects of these drugs. Steroids, unlike some other types of drugs, don't have any immediate dangers for the great majority of people. So that if you take steroids, you're not going to end up the next day in the emergency room in the manner of someone who takes an overdose of fentanyl or somebody who gets psychotic smoking
Yeah.
methamphetamine or whatever. But long-term exposure to steroids is, in fact, quite dangerous. And the reason is if you and I went out and decided to do some cocaine, we could go and snort a whole lot of cocaine, but eventually, within another 48 to 72 hours, we'd have to fall asleep. We couldn't keep doing it. Or if we decided to drink a whole lot of alcohol, we'd eventually collapse on the floor and be comatose until we recovered.
Mm.
But steroids, unlike the examples that I just gave you can have them in your system where the levels are 10 times or even 40 times greater than they would normally be, 24 hours a day, 7 days a week, 365 days a year. And the body can't say no. There's nothing that would cause that to stop, that you suddenly would no longer have them in your system.
Mhm.
So that you can expose yourself to years and years of these very high drug levels, if you like. And that is the principal threat. There are two particular threats that have become a subject of great scientific interest, especially in the last 2 decades. The first is the effects on the heart. The heart is a muscle. Steroids
Mhm.
affect muscles. The heart is, in fact, the strongest muscle of the body, and it's the only muscle that never rests. And not surprisingly, steroids can have quite bad effects on the heart. They can cause what is known as a cardiomyopathy, which messes up the ability of the heart to have good, strong, coherent contractions. And they can also lead to hardening of the arteries, so-called atherosclerotic disease.
Mhm.
And that raises the probability of having a heart attack or a stroke as a result of blockade of the arteries. We did a study published about 10 years ago where I recruited 86 men who had used steroids for at least 2 years. And of those 86 men who were between 34 and 54 years of age, among those 86 men, there were three who had had a heart attack prior to the age of 45. So that is a statistic that gives you some idea of the potential long-term dangers. And when we examined the amount of hardening of the arteries that had occurred in the arteries of the heart in these men, many of them had substantial accumulations of so-called atherosclerotic plaque, which was partially blockading the artery. So that's number one.
Mhm.
Number two is the neuroendocrine effects. So if you're taking testosterone or any other anabolic steroid for that matter, the hypothalamus in your brain, which is monitoring your levels of these hormones,
Yeah.
it looks around and says, gee, there's tons of testosterone coming in from the outside right now. There's
Mhm.
no need for us to manufacture any more.
Mhm.
And so the hypothalamus sends a hormone down to your pituitary gland and tells your pituitary gland, let's shut down the factory. We don't need to manufacture any more testosterone. We've got more than enough already. And the pituitary stops secreting its two sex hormones, which are called LH, luteinizing hormone, and FSH, follicle stimulating hormone.
Mhm.
And when those levels fall to zero, that tells the testis to stop manufacturing testosterone and to stop manufacturing sperm cells. And so as a result, the testis shrinks. And then if you take steroids for, say, 6 months or a long period of time, and then you stop, your own testosterone level will be way down, way below normal. And it can take months and sometimes years to recover back to its original baseline level. And recent research suggests that in some people, it never fully recovers, even after a long period of time. And it seems to me that if I were an 18-year-old kid contemplating taking steroids, I probably would not worry too much that I was going to drop dead at the age of 55 with a heart attack. But I would probably worry that I might lose my sex drive and have no uh, horniness and no erectile function, for weeks or years, for months or years after using steroids. And
Hmm.
that is a significant threat that has only been fully appreciated in about the last 10 years. I mean, it was known before that, but the magnitude of it was not fully appreciated until quite recently.
Wow. Wow, that's actually very fascinating. And looking at the second one real quick, so um that seems almost to me that's something that I hadn't thought about before because it seems a little counterintuitive that if you take more of a testosterone like substance, the function of testosterone might actually decrease in your body and you could lose that sex drive as you said. So I did have a question about that. So even though you're losing the sex drive, don't some of these steroids cause you to have like personality switches or mood switches that feel like would result from more testosterone in your system?
Yes, um, steroids have psychiatric effects, but what is unusual is that the psychiatric effects are highly variable, that a majority of people don't get psychiatric effects, even if they take large doses. But a minority of people can get severe psychiatric effects. So when you're taking steroids, most people don't notice very much of a psychiatric effect, but occasionally people will become very irritable, very aggressive, sometimes engage in criminal activity that was completely out of character for them, and on some occasions will kill somebody. And this can be someone who has never hurt a fly, who has no prior police record, no prior psychiatric record, no evidence that anything was wrong with them, who suddenly will have a complete personality change when taking steroids. And even now, we scientists still don't know why the great majority of people don't get these effects, whereas a small minority get severe effects and can end up literally killing somebody. Similarly, when you stop steroids, almost any male who has stopped, and I would mention parenthetically that about 98.5% of all steroid users are male. Um, but if you're male and you stop steroids, especially after taking them for a long time,
Hmm.
your sex drive will go down, erectile function may be impaired, and you'll feel more lethargic and less motivated to lift weights or whatever. But only about 10% of people will actually get depressed. And once again, the majority of people don't get depression, but a few people, a minority, can get severe depression, can sometimes even commit suicide. And we still don't understand why some people are vulnerable to both the on-steroid effects of aggression and the off-steroid effects of depression. There are some theories, but it has not been worked out yet.
Wow. Okay. That's pretty cool. So you have pretty like majority of people experiencing the low testosterone that causes a diminishing and depleting of your sex drive, and then there's also that chance that you might have very severe personality disorders. So really, there is no advantage to taking steroids based on what you said, right?
Well, obviously, if you're vulnerable to the psychiatric effects,
Yeah.
you will probably regret what happens.
Hmm.
But again, many people have not experienced psychiatric effects, and they talk to friends in the gym who have taken steroids, and they may not have met anybody who gets one of these psychiatric effects. And as a result, they may well think that there's little risk in taking them and be tempted to do so.
Mm. Wow. Okay. It's pretty fascinating and also definitely turns me away from steroid use if I ever would have considered it, but of course I wouldn't. Um I had a couple questions about the cardiotoxicity that you talked about. So you said cardiomyopathy, right? Does that refer to dilated or hypertrophic cardiomyopathy?
Um, I'm not enough of a cardiologist to be able to answer your question specifically. I think it's primarily a dilated cardiomyopathy.
Okay.
What happens is that um, normally, when the ventricle of your heart contracts, it shoots the blood out into the body, down your aorta, so that it circulates through the whole system, and then eventually comes back up through your veins and back into the heart. And normally, when the ventricle beats, it should expel at least 52% of its contents. And
Hmm.
it could even expel as much as 70% of its contents if it gives a nice, strong, coherent beat. But in steroid users who develop cardiomyopathy, that figure can fall below 50% and sometimes as low as 30%, where the ventricle is failing to get a decent amount of blood out into the system.
Hmm.
And that is known as a reduced ventricular ejection, left ventricular ejection fraction. Then there's also a problem when the ventricle is contracted and the heart is ready to fill back up with blood for the next beat, that the ventricle fills up more slowly because it's more stiff and not as rubbery and flexible as it normally would be. And so as a result, the what is known as the diastolic tissue velocity is reduced because it's expanding more slowly. So that the net effect is that the heart becomes much less efficient. Fortunately, some of that goes away when you stop steroids. It's not totally irreversible, but not all of it goes away. And even in people who've stopped steroids for a long time, there's some residue of that cardiomyopathy present.
Wow. Okay. Understood. Okay. So cardiac effects are definitely very, very important to consider when talking about steroid abuse, especially because it can affect you down the line. Even if you stop steroids, there is still a chance of you having some of those effects left over.
Yes, and of course, if you have atherosclerotic disease where you have hardening of the arteries, that will
Mhm.
definitely be left over. That's not going to magically disappear when you stop taking steroids.
Yeah. And is that disease caused, because I know atherosclerosis is caused due to the buildup of plaque from LDL cholesterol in the arteries. Since steroids are a type of lipid, right? Does that mean that are they contributing to that plaque buildup?
Well, steroids are not themselves lipids, but they have adverse effects on lipid levels in the blood,
Okay,
and that is one of several mechanisms that probably leads to atherosclerosis. But that is one of the primary mechanisms by which steroids lead to atherosclerosis. Yes.
got it. Okay. Um, while we're still on this topic of the effect of steroids, I saw another article that you published in the American Journal of Sports Medicine in 2015, where you discussed how tendon rupture could be another effect from steroids. And in that study, you found that many men ruptured tendons from falls, injuries, even simply lifting an object. Some ruptured two or more tendons, and you found at the end that the risk for tendon rupture is 9 times higher for anabolic androgenic steroid users. So, is there a possibility that even when you're trying to use steroids to build up your muscles, you might actually end up harming them?
Yeah, you have a much higher risk of snapping a tendon. Yes,
Yeah.
especially an upper body tendon. When we compared the men in our study who had used steroids with the men who reported no lifetime use of steroids at all, the number of men who ruptured a lower body tendon, like their Achilles tendon or the patellar tendon in their knee, was not particularly greater in the non-users as compared to the users. But
Hmm.
for upper body tendons, the users had a dramatically higher rate of tendon rupture of upper body tendons, such as the pectoralis chest tendon, the biceps tendon, triceps tendon. And in those cases, we believe that it was due to the fact that the muscle gets bigger and bigger and stronger, but the tendon does not get any stronger.
Mm,
And there's some evidence that the tendon, if anything, may actually get weaker. So the net result is that the probability of such a rupture is strikingly greater in upper body tendons among steroid users.
got it. Wow, that's pretty that's pretty interesting to think about. So steroids, even though you might be trying to use them to build up your muscles, you could have there's a small chance of personality effect, of course, but you could have reduced sex drive, you could have impacts to your heart and your arteries later in life, and you might even end up injuring a tendon, which could ruin your athletic career or your gym career if you're in that. So from an athletic perspective or from the athlete's perspective, how might steroid withdrawal affect these athletes? And what are some of the best methods that you have or you think about regarding rehabilitation?
Well, there's a lot of debate about that, and science is not particularly knowledgeable about what is best. And the reason for that is that it's very hard. For example, if I want to study high blood pressure and I have a new drug that I think will help with blood pressure, I can launch a placebo-controlled study where I get several thousand people and half of them get the real drug and half of them get a inert placebo, and I can analyze under double-blind conditions whether it works. But if you have somebody who is using an illicit drug, you can interview people out in the field, but that's not nearly as clean as a study where you're intentionally giving a fixed dose of the drug under blinded conditions.
Mhm.
And furthermore, you can't ethically do studies where you administer large doses of an illicit drug to people
Yeah,
because the Human Studies Committee would not accept it.
yeah,
It would be unethical to do that. So as
mhm,
a result, a great deal of what we know is just from observational studies and from anecdotal experience, and to some extent from studies such as the one that I did of the cardiac effects. But again, with regard to dealing with steroid withdrawal, we still don't know a great deal. I and one of my colleagues considered the possibility of maybe doing a study looking at actual potential treatment for steroid withdrawal, where half of the steroid users or half of the withdrawing steroid users would get a medication to try to reduce the symptoms of withdrawal, and the other half would get a placebo. And
okay.
none of the people that I spoke to had any interest in participating in the study because they were so afraid that they'd get the placebo. So that it proved to be unfeasible to do it. And there are some people who argue that even if you do use drugs like human chorionic gonadotropin or other such drugs to try to minimize the effects of withdrawal, that maybe you're just postponing the inevitable, and that you end up paying the price later on, even if you don't pay it immediately. So this remains a controversial area, and it's one of the many areas where the underground knowledge about use of steroids that you can have on the internet is huge in comparison to the uh, above ground legitimate medical knowledge that is published in journals. So that, as is the case with many things on the internet, there's a vast amount of material on the internet, some of which is correct and some of which is totally false, and which but where individuals swap stories and information of unknown value.
Absolutely. That's very, very interesting and very very sort of insightful to hear that some of these studies people may not want to even participate in or even try that because they feel at risk to not get any help or maybe feel like they're getting help when they're really not. So that's very interesting. And of course, you mentioned some of the ethical issues that go alongside some of these rehabilitation techniques or even the studies that you mentioned. So, while we're on the topic of rehabilitation and withdrawal, I also wanted to ask you another big thing, another big reason why athletes get into steroids and why they sometimes don't even quit using them is because of body image, what they want to look like in public, and how certain ideals have kind of been pushed by media throughout the last, well, for really forever. The media has been a prominent part in that. So, could you talk a little bit about body image and how that's sort of influenced or risen with steroid use?
Definitely. Um, there has been an increasing emphasis on male body image, especially in Western cultures, that has particularly evolved over about the last 50 years. For example, when I was in high school, when I was your age, very rarely did you see anybody who actually went to a gym and lifted weights. Uh, and My father and my grandfather, they never worried about whether they had a six pack of abdominals or what their bicep looked like. It just was not an issue. But
Hmm.
starting perhaps in the 70s and 80s, you begin to see an evolution of more and more emphasis on male muscularity. You see movies that came out in the 1980s with muscular stars and more of an emphasis. And you see more muscular figures appearing in television dramas, magazine advertisements, cartoons, and so on. And one example of this that I had wanted to show you is in action toys. Action toys are the toys that boys play with when they're young. And America's most famous action toy is G.I. Joe, who first appeared in 1964.
Hmm.
Now, I happen to have an original 1964 G.I. Joe right here. And as you can see, if he were my height, he would be a perfectly ordinary looking dude. He doesn't have any exaggerated musculature. His biceps are normal. His chest is normal. He looks like an ordinary guy. But if we look at G.I. Joe a mere 5 years later, we see that G.I. Joe has started to spend some time in the gym. He's got bigger deltoids, bigger biceps, a bit more of a chest, even a suggestion of abdominal muscles. And then if we go another 10 years or so into the future, G.I. Joe has not only been spending time on the gym, but he looks like he might have done a cycle of steroids. That now he's got a 16.5 inch arm if he were my height, complete with a full six pack of abdominals and bigger chest musculature as well. And that trend has continued. Uh, so that this is a graphic example of this increasing emphasis on male muscularity in Western societies. And you and I see so many images like this in an average day that we don't even think about it. It's become just very ordinary to see muscular figures in various advertisements. And the net effect is that for some young men, especially young men who happen to be vulnerable to these particular worries, that they may get very fixated on the fact that they're not big enough.
Hmm.
And that can drive them into compulsively lifting weights and then going on to using anabolic steroids.
Wow. Yeah. I mean, yeah, that example is I really love that example because it highlights that not only with the evolution of steroids, like and their development and the rise of black markets and all that, not only did athletes and even ordinary people in the gym begin to look at steroids because of that, but also more prominently because of the media, especially as male body image became something that's so important over the last 50 years, especially in Western society. So that's really, really, really interesting. And kind of going off that, so we talked a lot about the effects of steroids and why people are using them, why withdrawal is sometimes an issue. But could you talk a little bit about how sports medicine professionals can better address some of these issues with anabolic androgenic steroid abuse? And should this be addressed maybe at like an early level, maybe in high school or college when people are young, growing, and kind of starting to think about their futures?
Well, certainly educational efforts are desirable. Um,
Mhm.
but one of the issues about steroids is that the median age at which men start to use steroids is about age 23. So steroids are adult drugs. Only 5 or 6% of all steroid users have started using the drugs before they turned 18. And as a result, uh, the typical man who's using steroids is a man who's in his 20s or 30s. He's no longer living with his parents. He's no longer being going to school and having teachers or coaches looking after him. So he's not visible. He is an independent person living on his own, and no one can see, uh, uh, if he is using these drugs. So as a result, it's difficult to intervene with steroid users because they don't end up in the emergency room requesting a doctor. They don't end up coming to a psychiatrist saying, I want to stop taking these drugs. In fact, the last thing they want to do is to stop taking the drugs because they want to get bigger. So as a result,
Absolutely.
it's quite hard to intervene and to try to do anything aside from the educational efforts that I described. But there's a large population out there that are very hard to reach and that don't usually come to the doctor's office.
Absolutely. That makes a lot of sense. And I think as you said, I totally agree. I think it's really important that the education be more important and be at earlier stages so that these kids are aware of the issues with steroids before they become adults and even consider using them. I know when I was in health class in middle school and even high school, we I don't really remember touching on steroids. Maybe we did, but it must have been extremely brief. So I think as you said, incorporating it into education and into required classes like health is really a core important thing that we should focus on doing. Um, so I had one more question kind of before um I ask you to about the future of this field. And this is sort of a personal question because something that I'm really passionate about is brain injury prevention and head injuries. And in 1988, you conducted a study which you published in Comprehensive Psychiatry. I believe that was a journal. But back like 40, 50 years ago when before brain injuries had really come into the public eye and come to be something that now we're all thinking about. You published a study discussing how head injuries might precipitate manic episodes, and you found that in that study that they may actually be causal to symptoms of bipolar in people that had no history or even genetic history of having bipolar. So could you talk a little bit about how head injuries might actually also cause some of these psychiatric disorders that we talked about today?
Well, we don't know why this happens, but head injuries is an area that has fascinated me for the last 40 years. And I've treated quite a number of people who develop psychiatric syndromes in the wake of a head injury. And the 1988 paper that you discussed is just one example of that.
Mhm.
Um, Presumably, what is happening is that the head injury is causing some area of the brain to be injured so that there may be some sort of subtle electrical activity going on in the brain, an area that is buzzing with a little electrical energy that's not supposed to be there. And one of the reasons that we suspect this is that there are three different drugs, at least three different drugs, that have been found to be very effective in treating bipolar disorder. One called valproate, which is marketed as Depakote, another one called carbamazepine, which is marketed as Tegretol, and then another one which is marketed as Lamictal, which is lamotrigine. Lamotrigine is effective for depression, whereas valproate and carbamazepine are effective for manic episodes. But why would an anti-epileptic drug be effective for bipolar disorder? Um, and furthermore, how is it that having a head injury could cause you to develop bipolar symptoms which were identical and indistinguishable from those of someone who has the ordinary hereditary form of bipolar disorder and where it's come down the family tree and where they've never had a head injury. If you could tell me why a head injury and heredity could produce the identical illness, you could probably go to Stockholm and collect your prize. It's an area of great interest, and hopefully you will live to see that unraveled. But we still don't know what it is that is happening on a biological level to produce this same outcome.
Wow. Okay. Um, that's really fascinating, actually. And based on some of the psychiatric symptoms that you described with bipolar and some of the other mood or personality symptoms that you might like with the manic episodes and the depressive episodes that you experience within bipolar, do you think that some of these conditions may also be present from in the select few of people who have issues like nervous issues after using steroids?
The effects of steroids probably go by a different pathway because anti-epileptic drugs have no particular effect uh, on the hypomanic or depressive symptoms associated with steroid use and withdrawal.
Mm,
So that there probably are different pathways.
yeah. Okay. But probably wouldn't be too great for an athlete who suffered head injuries and is using steroids, um, from a nervous standpoint and from, I guess, other standpoints as we discussed with all of the adverse effects that steroids can have. Um, so yeah, so kind of looking now to the future, could you give some of your final thoughts for people curious about where this field of steroid use is going? Like looking ahead, what advancements or emerging research on the field of steroid use and abuse prevention do you think hold sort of like the greatest promise for improving detection, treatment, and prevention among athletes?
I don't see a very optimistic future. Uh, for one reason, um, many drugs of abuse, like cocaine and heroin, are illegal in every country, whereas steroids are perfectly legal in many countries, but illegal in others. So that in the United States, for example, steroids are a so-called Schedule III drug, where they're under the jurisdiction of the Drug Enforcement Administration, and where it's a felony to use them or sell them. Uh, Whereas you can buy steroids over the internet that are being shipped from Latin American countries, from former Eastern Bloc countries, from Southeast Asia, from China, and where the seller is able to obtain the steroids perfectly legally and then package them up. And as long as you don't get busted when your package comes over the border into the United States, you can use them. And it's very hard to shut that down. There's no easy way to prevent them from flooding across the border into countries where they are illegal. Um, so the supply is going to continue. The emphasis on body image that we discussed earlier is certainly going to continue and has been amplified even further by the evolution of social media over the last 20 to 25 years. And so as a result, the forces that breed steroid use are unlikely to go away. So I think that it will continue to be an issue, and I don't see any obvious reason that it's going to stop in the foreseeable future.
For sure, for sure. I mean, yeah, as you said, I think the evolution of steroids and technology alongside it has just made the media such a larger given it a larger presence than it had in promoting steroids and pushing steroid use through body image as you described within society. And so I guess as we discussed, really one of the main things that we have to do in sports medicine is education because that's one thing that is in our hands. Try to help as and educate as many people as possible before they get to the age where they might consider steroids. Would you agree with that?
Yes, I would. And to
Fantastic.
educate doctors as well.
Yeah.
Um, that was sort of just in conclusion, I would point out that in most cases, you can't tell when you see somebody whether or not that individual has used cocaine or methamphetamine or oxycontins, but you can distinguish a steroid user when he walks in the office door because he has exaggerated trapezius and deltoid muscles and is disproportionately big, especially in the upper body. And in a situation like that, especially sports medicine doctors who are particularly likely to see such individuals have got to be familiar with this to the point that they can sensitively, sympathetically ask the patient about possible use of these drugs and have an open discussion with the patient. And if you can't do that, then there's little hope that you can actually be of value to an individual.
Absolutely. That makes a lot of sense. So educating at the schooling level, educating doctors about how they can speak to patients and even like look at patients and understand that they do use or might use steroids. And is there anything else that you think we ought to do from a public health standpoint, nationally, internationally?
I I'm not don't know of any obvious new step that we can take. Uh, I believe that this is going to continue to be an issue, and that 20 years from now we could be talking
Mm.
in a very similar way on this to this interview.
Yeah. Okay. Well, I guess then the only solution is to do what we can, educate doctors and educate children before they become adult. Absolutely. Well, Dr. Pope, it's been absolutely amazing having you here. I know you're really busy with all your research and all the amazing things you have done and are doing. And so I really, really appreciate you taking the time to come and share some of your expertise and your insights on this incredibly important topic of steroid use and abuse within sports medicine. So I absolutely loved having you here and thank you so much for coming in.
My pleasure.
Thank you.